while South Africa continues to grapple with the newly discovered COVID-19 Omicron variant, which could be more transmissible than previous mutations, the Department of Health has now given the green light for additional vaccine shots for people with compromised immune systems. Acting Director General, that's Dr. Nicholas Crisp, says the category includes HIV-positive South Africans who have a CD4 count that's lower than 200. Let's get you more on this then. Bring in Mia Malan, Editor-in-Chief at Bhekisisa Center for Health Journalism. Mia, good to see you on this Sunday morning. So this announcement by the Health Department, is it all to do with the reaction to the new variant?
No, I don't think it has to do with reaction to the new variant. This was actually announced quite a while ago. So the announcement was made that they're looking into the possibility of doing these additional shots. And I think now the pilot project is just ready to start with it. Now, it's important to note that these shots are not booster shots. These shots are for people who have very weak immune systems with very specific conditions, and for who the primary schedule, so the ordinary number of shots that you would get for Pfizer or for J&J, for who those shots are not enough. So the difference between boosters and this is that these are for very specific conditions. It's not because the effect of the vaccine waned. And secondly, it happens faster than boosters. So these shots happen 28 days and onwards after your last primary scheduled shot. Boosters, as you know, for instance, for Pfizer, happen 6 months after your second shot. So this is a little different. It's specifically for people whose immune systems are so weak that the ordinary number of shots that you get for a vaccine isn't enough.
So why then aren't we rolling out boosters, given the fact that we have already such a low uptake among the general population? Less than 40% of people in this country are fully vaccinated.
That's a great question.
Some not interested to vaccinate at all, Mia.
Yes, so that is a very important point that you raised. So why are we not doing boosters? Well, before we can do anything like that, we need our Ministerial Advisory Committee on Vaccines to make a recommendation. That's the procedure that we're following. So from what I understand, they are in the process of making recommendations for people with comorbidities. So not just the people on the list for the additional doses, for everyone, for instance, who has diabetes or other comorbidities, and also for people of 60 and older. So those recommendations we're likely to hear about later this week, most probably, and then those things will get to be implemented relatively quickly. As you've pointed out, we've got enough vaccines in the country and a low enough uptake to have additional doses to start with boosters, but we really can't start with those until we have the recommendations of the Ministerial Advisory Committee.
You know, I spoke to a doctor, a South African doctor based in the UK on Friday, who was saying one of the frustrating things as a South African observing from a distance is how in the vaccine process, there appears to be sometimes quite a long wait, a long sense of deliberation between when things are discussed and when a decision is ultimately announced. And it appears we're possibly doing the same with the boosters because it's a conversation that's now weeks old, isn't it?
Well, the booster data has been available for a while, but we can't just introduce things, without a procedure in South Africa, because we need to make sure that our own experts have reviewed the results. Mm-hmm. Now, I do think that process is is being sped up at the moment, and as you mentioned, it does take a while to happen. But I don't think my impression from speaking to Health Department officials is not that we're going to wait for a very long time before these things happen. If we have the recommendations from the MAC, and if they're positive, then it shouldn't be months before we get boosters.
And who's covered under the category of immunocompromised? I reference people who are HIV positive, a CD4 count below 200. Who else?
Yes, so for these additional boosters, or not boosters, these additional doses, they are very specific conditions. So for instance, if you have HIV that you've mentioned, it's not just if you have HIV and you're on ARVs and you have a good immune system that you qualify. You won't. You will only qualify if your immune system is weak enough. And to measure how weak or strong your immune system is, they use something called the CD4 test, and if it's below a certain count, then you can get it. It's also for people who've had organ transplants and are then on drugs or medicine that suppresses their immune system. So the immune systems become weaker because of those drugs. And that is normally also people who use high-dose steroids, or people who, for instance, use medication for autoimmune diseases. So I have mentioned a few of those conditions. One more is, for instance, people who are on long-term dialysis. There are a few more conditions. It's too complex to mention them now. There is a circular that has gone out from the health department, and you can't just turn up at a vaccination site and then get the additional dose. You would have to go to a doctor or a nurse who would then have to fill out a form that's provided by the health department, and then you then have to register on the EVDS for that additional dose, or you can go with that form to a vaccination site and they'll help you to register.
You're talking about how local scientists need to gather their own evidence as we proceed with this vaccination program, especially as far as boosters are concerned. Something else that is different about the additional shots in South Africa is that people who got the single-shot J&J jab at the beginning of the year will get a second one. If you got Pfizer, you'll get a third dose of Pfizer. But internationally, there has been a conversation about mixing. So if you got Pfizer, for example, give you a different vaccine as an additional shot as a booster. How clear is South Africa's path on that going forward?
So we don't have a policy that's been announced on that yet. It's entirely possible that we could have a mixed policy, that the health department could create a policy that you could choose which booster you want. We just don't know yet. And again, that decision will also depend on what the Ministerial Advisory Committee recommends. I have not yet heard about the developments around that, but what I do know is that the health department has the authority to create a policy around it. It doesn't necessarily first have to be registered by SAPRA.
Mia Malan, Editor-in-Chief at the Bhekisisa Center for Health Journalism. Always good to speak to you, Mia. Thank you.